at Apollo Hospital, Bangalore, Dr. Savit and Dr. Asha. I welcome you, and it's a privilege to have you here with us. And you'll take us through what a breakthrough procedure we've been able to operate on, or we've been able to accomplish at Apollo Hospital's Cancer Center, Bangalore Road. But before I hand it over to Dr. Nair, I just want to kind of set the context a little bit to give you an introduction. While Apollo needs no introduction, but we are the largest, it is the largest private healthcare chain in the country, but also runs the largest cancer center network in the country. To our credit, it was among the first few cancer centers in the state. The cancer center had the first brachytherapy unit installation. It was the first center, a significant step forward, an important step forward in that direction. Because cancer therapy or cancer treatment today, in that sense, what you will hear from Dr. Nair is what our real intent has always been: how do we marry technology and great clinical skills to improve the lives of the patient. And organ preservation, I think, is a key milestone that we've been endeavoring to achieve now.
So we had a lady, a 35-year-old lady from a foreign national. She has a busy social. A 35-year-old lady from a foreign national. She has a busy social. So she had a lot of evaluation of this particular condition throughout the world, I would say. When she came to me, she had investigations and opinions from almost half the part of the world, the Europe, the Middle East, etc. So the patient has diagnosed as a case of facial nerve schwannoma. Now before I go further into facial nerve schwannoma, I will try and explain to you what is this facial nerve and what is the facial nerve schwannoma is. Because if you don't understand that particular aspect, maybe you lose the context. So there's a nerve from the brain which comes, supplies one half of the face, both sides. So everything that you move, that you speak, a nerve, these kind of things. When you look at the photo, the round thing is the tympanic membrane. Those two patient does not move at the angle of the mouth.
So at the Apollo Hospitals, Bangalore, we performed the first time in the world a transcanal endoscopic excision of facial nerve schwannoma. The facial nerve schwannomas are tumors that are present in the intricate area inside the ear. So there was this patient who had this tumor for a couple of years and had developed various symptoms with it. As the patient wanted a minimally invasive technique, we went about performing the surgery by an endoscopic technique through the ear. There were no scars or drilling of the bone performed. There were no bandages after surgery. The complete schwannoma was removed through the canal with an endoscope, with excellent results.
How much time it took?
How much time it took for? Yeah. So the surgical process completely took about 2 hours, excluding the anesthesia. The patient, the facial nerve tumor was removed through the ear with an endoscope and was also reconstructed with a nerve, placing all the ossicles and all structures back. The complete hearing was restored and the facial function has started improving.